Most healthcare spending is directed at chronic conditions, the majority of which can be managed more effectively through improving lifestyle decisions and adherence to evidence-based care plans. Patient adherence is often a key. For instance, Intermountain Healthcare analyzed 20,000 patients who comprised their top 1% highest cost patients. 66% of these patients attributed themselves, not the care they received, as the more significant impediment to their improvement. PHCC has designed many approaches to reduce overdependence on medical solutions and improve patient self-management. These may support Anthem's enhanced personal health care initiative in important ways. This 5-minute video provides an overview of how many of our programs are designed. The following screens show samples from one of our internet-based programs. It is geared to help people with type 2 diabetes improve their adherence to diabetes, lipid, and hypertension medications, complete A1C and blood glucose testing, and make sustainable health lifestyle changes. What do we do that is different? As you'll see on the next few slides, this approach leverages the influence of clinicians and care coordinators. It has been highly acceptable in real-world settings. Customizing and implementing this program is inexpensive and easy. Minimal staff training and support is required. The software was designed with support from the National Institutes of Health and CMS to meet the needs of complex patients, including Medicaid and Medicare beneficiaries. This is a sample initial screen that a patient sees when they open the program. To begin, they enter a specific access code that has been given to them by their provider or site care coordinator. This is the next screen in the program. A patient chooses one of the 5 topics covered in the program. These include weight management, healthy eating and diabetes, physical activity, smoking cessation, adherence to medications, and diabetes testing. A caregiver can suggest a specific topic area, or a patient can select his or her own priority. The program then guides a patient through a series of screens. Some screens, like this example, help patients better understand their potential to reduce diabetes-related risks. Some screens assess the patient's unique history or preferences. Screens like this ask patients to enter information related to topics such as their goals, their perceived barriers to adherence, or other unique issues. Some screens encourage them to identify clear action steps they want to take. As the patient works through the program, the software is constructing a tailored report similar to this sample. This report is immediately available at the end of the program. It provides suggestions that address their specific needs and priorities. It can be printed or emailed to a specified address. Some topics are a bit longer than others, but it would typically take about 15 minutes to complete a topic. The patient can come back to the program and work through other topics at another time. It is clear that physicians and other caregivers often have a high level of patient trust and respect. This program tries to leverage this influence by giving the caregiver a tailored report to provide insights into what might help the patient make sustainable changes. Here is a sample. It begins with basic patient information, including name, date of birth, ID number, and the date the patient used the program. This report is a half-page bulleted list of items covering topics such as a patient's priorities, adherence struggles, perceived barriers to making improvements, and short-term actionable goals. It should only take a few minutes to use this caregiver report. Discussing the report is done at a usual care clinic visit or phone-based contact. Multiple caregivers can receive copies of this tailored report. Here are a few key points regarding the design of the software. The emphasis is on patient self-management and patient-derived actionable goals. Your providers may be in a good position to help many patients access and use the software, address needs and interests the patient identifies, utilize the program as a base for further diabetes management, and maintain their motivation during usual care follow-up. To use the program, a patient will need access to a tablet, iPad, or computer connected to the internet. A larger model smartphone will work for people with minimal visual impairment. A process to introduce patients to the program is customized for your needs. Although most people with very limited computer skills can navigate this program, some patients will need assistance. In some applications, a care coordinator can support a patient in completing an assessment.